Hello, everyone. Welcome to another CanXida webinar. This is a great topic today that is specific to CanXida. Many people have questions about, how do I take this? How often? How to use the CanXida products. So that's what I'm going to talk about today. And I will give you an overview of the three main products that we have in our protocol for Candida, how to take them and give you a little bit of a table that also lays them out. And then I'm going to go over some frequently asked questions that we get from customers, especially newer customers. So hopefully I answer most things that you are wanting to know here. And I will share my screen with you because I have some of these things on slides so that it's a little easier to follow. Alrighty, so the CanXida dosage guide. Before I get into the dosing of these, I just want to put this out there. I talk about this if you watch the full comprehensive webinar that we have on our CanXida YouTube page. You'll see that in there I talk about this, and this slide is from that, and it's just a reminder that um, when you get Candida overgrowth, it happens for a reason. It doesn't just happen out of the blue. These are some of the common reasons that Candida can become overgrown in the gut, but also contributing to like vaginal yeast infections and things. Um, this isn't comprehensive, but these are some of the most common, and a lot of times it's multiple of these. It's not just one. It's not just antibiotics on its own or oral contraceptives. It's not just stress or, lack of sleep disturbance, that sort of thing. It's a combination. It's dietary along with maybe antibiotics or another medication and unmanaged stress and maybe too much alcohol. It's a combination of things. So, because these are the most common causes for contributors to candida overgrowth, these things have to be addressed. You can take supplements and have an impact and improve, but if these things are contributing, whatever the cause is, if that doesn't change, you'll take supplements and improve and then stop, and it'll probably come right back. The candida will just get the same opportunity you got the first time. And so everything I'm going to mention about using the CanXida products is in relation to also addressing some of the root causes of why it's there in the first place, right? This is a one-page guide of our three-phase Candida clinical protocol. There is a longer version. This is just the condensed down to one page. I just want to show you what this looks like. In our description, we have technical papers available as well as the full protocol. The links to all those things are in the description. But just to show you that there's generally three phases of how we've laid this out. And you'll see under phase one, the first thing is CanXida formula remove, restore, and rebuild. So these three together is what I'll be talking about, and these are along with our dietary recommendations. Here, I'm only going to be talking about how to take the supplements. If you want to learn more about the diet, I talk about that in many other of our webinars. In the full comprehensive webinar, I talk about in detail how to use the supplements along with the diet, but this is just focused on the supplements today. So the phase one is 3 months in my mind. I also want to just say before I jump into this that this protocol and really any protocol, they're really guides and they need to be flexible for the individual. So you can take what I'm saying as just a general guide, and you need to meet yourself where you're at, right? So I'm saying that phase one is usually 3 months. It may differ a little bit for some people. If it's not a very serious candida overgrowth and it hasn't been going on very long, maybe 1 or 2 months for the phase one will sort of work, but usually at least 3 months. And the full protocol looks at least 6 months because most people need phase one of 3 months and phase two of 3 months, kind of something like that. So it's a general guide. And the first formula I'm going to talk about is the Remove formula RMV. This is a cleansing formula, a Candida cleansing formula. It removes excess Candida numbers and helps to restore eubiosis, which is dysbiosis, which a term most of you probably know as an imbalance in the microbiome. Eubiosis is the balance. So we want to restore eubiosis because there's dysbiosis. And the way to take formula RMV, this is one of them that more than any of the others really can be variable depending on the sensitivity. A lot of times is the main thing that guides it. In general, most people can start with one tablet twice a day. If that's a little bit too much, you're having some upset stomach or heartburn or just feeling, off for any reason, you might just try one a day, and you could split that into one tab. You could split one tablet in half and do half a tablet twice a day. So that's just a total of one tablet a day. But wherever you start at, give it a few days. Three or 4 days should be plenty to get an idea for how you are responding. So if you start at the general dosage that works for most people of one tablet twice a day, wait 3 or 4 days, and if you're feeling, pretty good, you're not having any major kind of stomach upset or what might feel like die-off types of reactions, those sorts of things. After a few days, then you can increase it to one tablet 3 times a day. Uh, Sometimes, people can be quite sensitive. Sometimes they're sensitive to the ingredients in this. And some of you watching this are probably the type of people that you're sensitive to everything. It maybe it's medications, it's supplements. It doesn't, you can take herbs, whatever it is, and you just are more sensitive. And that's just how some of us are. So if that's you, decrease the starting dose. You could, like I said, a half a tablet twice a day. But some folks that could be really sensitive might start at an eighth of a tablet or a quarter of a tablet. So it's okay to do that. But the goal with the formula RMV is that you want to get up to what we would call a therapeutic dose. So you can start as low as you need to. But the idea is every few days, as long as it's going okay for you, that you increase that dose until you get to the typical dose that we want people at is 1 to 2 tablets 3 times a day. I would say more often than not, it's 2 tablets 3 times a day. One tablet 3 times a day would be for a pretty minor candida issue. So 2 tablets 3 times a day is a general therapeutic dose to kind of aim to get to with formula RMV. And this is one way that you can also think about the protocol, the 242 protocol. So with a 2 week induction phase, and that's kind of what I was describing about increasing or what we might call titrating up in the dose. Now, if you are going slower than that, maybe it takes you longer than 2 weeks. But, in general, 2 weeks maybe to increase that dose until you get to, let's say, the 2 tablets 3 times a day. This 4 week treatment phase in the green here, this is what I'm talking about with the therapeutic dose. So whenever you get to the therapeutic dose, stay there for 4 weeks. It's a good idea to stay there for a month. And then you can decrease the dose. Sometimes I'll have people just decrease, by half, something like that, and still stay on the formula RMV. But it's okay as well to just especially if you're really going after some of the root causes and really have your diet dialed in, it's okay to back off and just see how you're doing without it. And then I would say phase back up again, right? Because I was saying phase one is 3 months. So, this here is taking 2 months to do the 242. So I would say go back up again and do another 4 weeks after you give the cool down phase of 2 weeks. Go back up to the therapeutic dose. Again, on average, most people, I'm going to tell them when they work with me, and they have a candida issue, I'm just going to say, just plan on 6 months of doing the kind of cleansing, if you will, the cleansing protocol with the formula RMV. We need to keep these antifungal and antimicrobial herbs and other natural products at a good level for a good amount of time because it can take a while if candida got a really good hold in the gut or anywhere else in the body. It can take a while to decrease those numbers enough and then restore healthy bacteria that keep the candida in balance to where we don't need the formula RMV anymore. And here, Just again, kind of a little table of what I was saying about you can kind of see this for sensitivity levels. And some people also do have a high tolerance. Now, the formula RST, the restore formula, this is restoring, sort of helping to restore nutrient status and largely helping to restore healthy gut bacteria, because again, that's what keeps Candida in check in a healthy gut. Um, the dosage with this is somewhat variable. Uh, it's at least one capsule twice a day is what I recommend. And a lot of times I will say do that in split doses, the one capsule twice a day. If that's hard for you, it's okay to take two once a day. But it's just a little bit nicer with any of these to keep them in your system throughout the day. So one capsule twice a day is kind of the minimum, but you could go up to six capsules a day with this. It's a digestive enzyme and a probiotic in one. So very safe in that, right? And maybe you want to take two capsules with each meal, each main meal. Maybe you have three meals a day, and you want to take two capsules with each meal because there's digestive enzymes in there. It helps you digest your food, right? And then you're also just getting more probiotics. So that's completely fine. And some folks want to do that. One mention on this is sometimes it can be helpful during at least the phase one to take at least one capsule at night without food because of one of the enzymes, the serratiopeptidase that's in here. Sometimes that can be a little bit of a modification that I might make. But in general, at least get one of these twice a day. And the formula RBD is the third formula in the first phase protocol, the rebuild formula. And this does all the things that are listed here. So this is essentially a really nice multivitamin and mineral with some gut healing herbs in it and some antimicrobial herbs and other gut healing herbs in it. The vitamins and minerals in here really support your immune system and are there to replenish any nutrient deficiencies that may have happened from malabsorption, from the Candida using those nutrients itself, potentially bacterial dysbiosis that's there as well. So this is a really good idea to be on this formula for that full 3 months of the first phase. And one capsule twice a day is usually what I do. I do all of these with food. And uh, the formula RBD is one that's not recommended to go higher than the serving size because you don't want to get too many of some of these vitamins and minerals, right? These are pretty high doses in here. So this, along with your diet, should be plenty. And this is one that I don't recommend to go above the two capsules a day. Now, the last product that I want to talk about is typically one that I bring in the second phase. So usually after 3 months, really, you can just think of the recharge formula as after 3 months, it kind of comes in behind the last supplement, this one, the formula RBD, the rebuild formula. It comes in and replaces this. So whereas this has quite high doses of a lot of vitamins and minerals in it, this has a lot of the same vitamins and minerals, but more at a maintenance dose. This also, though, has a lot of gut healing nutrients in it, like the L-glutamine and the glycine that you see there in the ingredient list. So after the first 3 months, I'll usually have people come in with the recharge formula and uh, I would say, at least 1 to 3 months with this. The second phase is 3 months, but it's really a nice one to just use indefinitely as well. It's one that I use on a pretty regular basis at my house. It's got a lot of protein in it, so it's like a protein powder with a nice multivitamin aspect to it, and then gut healing nutrients. This is 1 scoop a day, and you could always do half a scoop twice a day if you wanted. It can be with food or without because there's enough protein that it can kind of be a little bit of a meal replacement. So again, um, everything I said is here on this table. And just think of the first 3 months, it's the formula RMV, RST, RBD. It's the first three on here. Then the second 3 months, everything's the same, except you're flipping out the RBD and the recharge for the RBD. And you don't have to do that either, by the way. You could stay on the rebuild formula if you want to do that. It's just one thing that I will often recommend to folks. You can pause this, take a screenshot. This is your little guide if you want to keep this on your fridge or something like that to sort of help you remember all the things. It's everything that I just said. Um, the one thing I maybe didn't mention is that the formula RMV, the remove formula, sometimes, and this is where individuality comes in the specific situation. Sometimes folks need more than what I said. I said the general therapeutic dose is maybe 2 tablets 3 times a day. Well, that would be six, but sometimes we might go 3 tablets 3 times a day. It just sort of depends on the situation, how strong of a antimicrobial, antifungal approach we need. But again, the general is probably six a day. And all of these are with food. The recharge formula can be with or without food. But the other ones are recommended to be with food because the formula remove is a sustained release formula. So it taking it with food sort of can help that to trickle out even slower, release more sustained. And same with the formula rebuild, the multivitamin, sustained release. And it's always helpful to take, nutrients that you want to absorb, like the multivitamin. It's good to take those with food because your body's already in the phase of digesting food, right? And absorbing things. So things that you want to digest and absorb, it's good to take those with meals usually. Let's talk about the frequently asked questions. What if I forget a dose? It's okay. You could just pick up where you left off. Really, it's that simple. If you forget a dose, there's really no harm done. It if if you think about even just 1 month of doing what I was just recommending, if you do that every day for a month, uh, if you forgot 5 doses in that month, even, it's a little blip on the radar. It's really not a big deal. It's more about the overall picture of have you been generally consistent? And then, yes, it's okay. If you are finding yourself consistently having trouble remembering doses, you might consider shifting, uh, keeping the same daily dose, but shifting how you're taking it. So, if for some reason, say you are up to the six formula remove a day, 6 tablets, and you were trying to do 2 tablets 3 times a day, and you just only half the time can you remember to take the lunchtime dose, the middle of the day dose. If that's really an issue, then that could be a problem over time, right? In that there are, potentially half of the days you're not getting to the high enough dose that you need. So if that's the case, I would say take three twice a day. And so just, keep the same daily dose as much as possible. But if you're having an issue remembering one, and oftentimes the one that people forget is like the middle of the day because they're working in those things. So you can modify it that way, and it still should be just as effective. What if I feel worse when I start? Well, there are a lot of reasons that you could feel worse when you start a Candida protocol. So, a lot of times folks think of a Candida die-off reaction, and unless you're really going in heavy-handed, if you will, with the level of antifungal and antimicrobials, die-off shouldn't really be too much of an issue. I did a whole webinar on candida die-off reactions and how to avoid them and that sort of thing. That's here on our CanXida YouTube page. So check that out. That I think you'll find that really helpful in relation to this conversation. But most of the time, feeling worse when you start isn't so much of a big die-off reaction. Some of it might be die-off, but there's a lot of other things that can be going on, is what I want to say. And, especially in the digestive tract, you are completely changing up in somewhat quick order the whole ecosystem of the microbes in your gut within only a couple of days, right? Because you start out with some antifungal and antibacterial herbs and things. You're also going with probiotics, and so now there's a different bacteria that you're introducing, and you're changing nutrient availability by having digestive enzymes, and you're putting different nutrients in there because of the multivitamins. So there's just a lot going on. So especially in the digestive tract, and especially at the beginning of starting the protocol, if you're having a lot, you're feeling gas moving around, you're getting maybe loose stools and that's, sort of thing. I wouldn't worry too much as long as you generally are feeling okay. Like that's very normal. Um, Sometimes you might get an increase in, brain fog or fatigue and those sorts of things at the beginning. If that's the case and it's manageable, I would say stay the course for the most part, but listen to your body, trust yourself. I think that, we all know ourselves better than any other person or doctor could, right? So just trust yourself. And if you're like, no, this is like a little too much, it's too intense, whatever, I don't know if this is the right track, all you need to do is just back off a bit, just decrease the dose. And that's usually, I'm talking about that specifically with the formula remove. If you feel like it's too much, then just back off. If you really feel like it's too much, or you're getting a lot of digestive upset that just is really uncomfortable, then I would say potentially stop the formula remove and focus on your diet. Focus on diet and lifestyle aspects, all of which I talk in great depth in the comprehensive webinar that we have here. Um, and get that stuff dialed in. And I would still continue with the formula restore and rebuild, by the way, during that. But just get everything dialed in really good, and that will get your system ready to be able to handle the formula remove most likely. So that's what I would say. But most of the time, in terms of a major Candida die-off, which is essentially a die-off that's large enough to really light up your immune system. It's really your immune system will see tons of pieces of dead candida essentially and toxins from the candida, and it will just make your immune system go on overdrive. And so there can be a lot of inflammation and uh, just feeling pretty bad. But that doesn't usually happen unless you give something like a pharmaceutical at a really high dose, and there's a lot of candida present to be able to get that kind of massive die off. Low and slow is the name of the game here. That's why I said start at one tablet twice a day, or even one tablet once a day is fine. There's no hurry here. You probably didn't get into the situation overnight. You don't have to get out of it overnight, and you won't get out of it overnight. So just start low and slow and increase as it feels tolerable. Should I take less if I'm sensitive? Yes, I think I spoke to that pretty well already. I wouldn't expect that there would be too much sensitivity to the formula restore or rebuild because the restore is simply probiotic and digestive enzyme. I have definitely seen probiotics, uh, change the gut flora enough that there's a couple of days of, bowel movements that are different and consistency and regularity and all of that. But that usually corrects itself within a few days. Um, but if that's the case, it's kind of a dose thing again. You just decrease the dose. Again, with the formula rebuild, it's a multivitamin. I wouldn't expect that you're going to have much issue with that, unless for some reason, there's always possible exceptions. So if you happen to be really sensitive to one of the maybe the herbal ingredients, you just didn't do well with that herb for some reason. Of course, that's a possibility, but these are not common things with this in my experience. So you should be fine. The main one that people are sensitive to is the formula remove if they're sensitive to anything at all. And so I think I spoke to that well enough. You just kind of, in medicine, I usually say play jazz. It's improvisation a bit. You kind of have your protocol, your guide, just like in jazz music, you have your sort of template that you're working from, and then everybody kind of goes off and does their thing, staying within the framework. And that's what this is. You just want to stay within the framework that's guiding you, but then you sort of improvise for yourself in your individual situation. how long should I take each product? I spoke to this in terms of, generally how it is with, in the protocol that we have set up here, but um, it's another one of those situations where it really depends on the intensity uh, of the symptoms and the severity of the Candida overgrowth, as well as the bacterial dysbiosis. Because if you have Candida overgrowth, you have bacterial dysbiosis in your gut, sort of by definition. Uh, and and so just depending on all of those things, and by the way, there can be other types of gut infections present and parasites and things. So just depending on the whole picture and what's going on, treatment can be a while. I said I usually tell people about, consider 6 months, but if you've been having issues for 5 years, just plan on a year to get better. If it goes faster, that is awesome. That's great. But in uh, in natural medicine kinds of approaches, um, I tend to think of it as, we're trying to be as holistic minded as possible to facilitate healing, and you can't make healing go faster than it will. Sometimes things go really fast. Sometimes people have been sick for 5, 10 years, and within 3 months, they're just a completely new person. There should be obvious improvements within a couple of months, but that doesn't mean that the whole thing is resolved. So, in terms of how long do you need to take the product, until you feel like, or you're working with your practitioner and you and your practitioner feel like, you can cycle off of these things, and you can clearly have chunks of time where you're fine. So if a month goes by, I would say, and without taking any of the products, and you're feeling okay, let's say hold steady with your diet and lifestyle approaches and see how another month goes. But if you try to come off of them and it's 2 weeks later and you're sort of can tell you're going right back to where you were, then there needs to go longer, and there's probably some other things that you need to figure out about, like, why did that come back so fast. So 6 months is probably a reasonable time frame to be doing some sort of supplemental approach, and some folks need to just go longer. Now, that doesn't mean, I'm saying a year. That doesn't mean that you need to take, most people do not need to take 2 or 3 tablets of formula remove 3 times a day for a year. That's not really reasonable and necessary. But there may be some cycling throughout a year, or there may be after, uh, 3 to 6 months of reaching the therapeutic dose of the formula remove, there might be a maintenance dose, right? There might be a lower, 1 tablet twice a day for the next 6 months. So, as you can see, there's a lot of variation in uh, what each person might need to do, but hopefully that makes sense, um, that there are many individual factors at play, and that sometimes the length, what's going on in that length of time is varying. It's not just like taking the thing at a super high dose the whole time, right? And also, just like I kind of mentioned, that formula rebuild, the multivitamin formula, that how I often will swap it out for the recharge formula, because that's kind of a nice maintenance dose, right? And so that's another thing. How long do you need to take it? Well, it depends on your dietary habits. It depends on your goals. Sometimes, if folks have a hard time eating regularly, or like they do really well if they eat breakfast, but they don't normally, uh, take the time to do it, that sort of thing. That's just another consideration of, like, well, maybe the recharge formula is a nice thing to just make it like a smoothie with in the morning or something. So lots of considerations, but in terms of the primary treatment protocol, plan on 6 months, and then if it's not resolved, then you may have to go longer. Some special groups that I want to talk about. So children, I really don't want to give dosage recommendations for children here. That means too many things. Children are very different ages and sizes and developmental levels and all these things. So it's really important to um, work with a pediatrician, someone who's knowledgeable, ideally somebody who's knowledgeable in natural medicine and pediatrics. So like a functional medicine doctor or a naturopathic physician, something like that, who has a special interest in working with children, because there may be health specific things that they need to consider for children. There's at the minimum, there's going to be a dosage adjustment based on weight that needs to be done. I'm not going to give that here because it just can mean too many things, and I really want everyone that has a child that they want to bring on these supplements and this protocol with, that they're working with a practitioner. Now, seniors, uh, sometimes things don't need to change from what I've shared, but it just, as we get older, the tendency is to become more sensitive to many types of medications, including natural therapeutics. And by seniors, I specifically mean elderly people, depending on, culturally what you consider that. Seniors could be 65 or 70, but I mean like more elderly folk. And it's just important to consider dosages with them that they might be more sensitive. Now, by the time someone's elderly, they probably have a pretty good idea of how sensitive they are. So maybe you can just ask them. But you might as well be aware that um, if you're elderly or somebody that you're working with is elderly, and you want to bring on CanXida products, especially the formula remove, you might want to consider starting just at a lower dose. It doesn't mean that the therapeutic dose will be lower, but a starting dose is possible. And again, might not be an issue, but it's just worth considering that oftentimes as we get to that stage of life, we are more sensitive to medications and natural products as well. Pregnancy and breastfeeding is another one that I am not going to mention here, and I would just outright not recommend it because it's one of those. It doesn't mean that you can't use them, but it's one of those things that I would never recommend it uh, without working with somebody who specifically works with pregnancy, right, and breastfeeding. So that can be, again, a functional medicine doctor, lots of naturopathic doctors work uh, as midwives or work with midwives, and they are, in pediatric practices, and they're working with fertility and they're working with pregnant women and breastfeeding and all of this, right? That's who I want to guide you on that. That's all. Not saying it should never be used in pregnancy or anything, but or breastfeeding, but most likely, like the formula remove, most people would probably say don't use that when you're pregnant or breastfeeding. Um, I would imagine. But when it comes to multivitamins, um, that's less of a concern. It's actually, in pregnancy, we usually like women to take a prenatal vitamin, but that's a different thing, right? It's a prenatal vitamin. So just work with somebody with that. And immune compromised, I just want to mention this, that uh, people who have an actual immune deficiency or immune compromised for different reasons, that can happen, can be certain health conditions, can be genetic, and so on. Um, those folks are at much higher risk for fungal infections, and they're at much higher risk for serious uh, fungal infections that can even be in a life-threatening realm. That's kind of the textbook situation of a life-threatening fungal infection that gets in the bloodstream and all this. That's in somebody who's truly immune compromised. And so I guess what I want to say with that is just, if somebody's got candida issues and they're immune compromised, uh, it it this absolutely makes sense to do this protocol, but because of the risk that they have, it would be really smart also in that situation to be working with a physician healthcare practitioners that are knowledgeable in what is the actual risk here, because sometimes medications have their place, and so sometimes a medication might be the best thing for a person, just depending on the individual scenario. So I know not a lot of specifics there, but that's because a lot of what I want to say is just be working with a knowledgeable practitioner. It's not always the best to be treating ourselves or giving recommendations to others, especially if they're like in these special groups. Warning signs to look for if you're taking too much and what to do about it. I think I pretty well spoke to this already as I was talking about, feeling worse early on. And nothing too terrible is going to happen if you take too much. It's just that you're just going to have symptoms that make you feel really crummy, basically, right? And it could make you feel heightened and even worse than you did before, depending on how much you took. And so we want to avoid that. Really, the thing to do is to decrease the dose, or if you took way too much and it was super intense, just stop for a time. Just do a washout for a few days. Get your diet in place. Start doing the things that you can do that are not taking a supplement, and then come back in low and slow. Like I said, the signs or symptoms that you might experience, digestive symptoms of really any sort. It could be could definitely switches in bowel movement frequency and consistency, heartburn or indigestion types of things. If you're having any stomach pain or like cramping or anything, definitely would say decrease the dose or stop for a couple days, do a washout, and then come back at a much lower dose. And sometimes, especially if you have IBS, uh, it could be possible that you're more sensitive to certain types of gastrointestinal uh, antimicrobials and things. So, in that case, I would do a washout and then just come back in at a lower dose. So, really, any digestive system types of things. Brain fog potentially could get really intense for some folks if you took too much. Fatigue could. If you took too much and got a kind of die-off reaction, really any kind of inflammatory symptom that you already had. So say joint pain has been your thing, one of your things that's been going on, and it's potentially related to Candida overgrowth. If you uh, took a large dose of, say, the formula Remove, thinking you want to just go in there and kill it as fast as you can. Well, you will do that, but you might create a big inflammatory response that may be somewhat short-lived, but it could cause a flare-up in some of the inflammatory symptoms you already had, like joint pain, for example. So any symptoms that you've already had that might be related to Candida, if those seem to be getting aggravated for any reason, I would say maybe just decrease the dose a little bit. Those are the main things that I think of. I will say, skin issues, if you're generally getting better, like brain fog's getting a little bit better, fatigue's getting a little bit better, uh, digestive symptoms, all these sorts of things. If you're kind of moving in the right direction and you start getting, uh, just run-of-the-mill skin issues like eczema and those sorts of things popping up, um, I I wouldn't worry too much. That's actually a direction of healing if kind of constitutionally, generally, you're improving. But now some things are coming out on the skin. I would say stay the course for the most part, and that you should see that the skin symptoms just eventually start to improve as well. If the reason it's a direction of healing is that the body kind of has its hierarchy, if you will, of things that it wants to protect and that are the most important. So vital organs, right? So our brain, very, very important, is like protected inside this big cranium that's, impenetrable. It can't get into it. A lot of other vital organs, they're protected, behind our ribs, right? Like our lungs and our heart and our liver. So the body physically protects them, but the body also, physiologically and energetically protects them as well. So most people would agree that having IBS is better uh, than having some sort of liver disease, right? Because the liver is a more important organ than a dysfunction of that sort in the digestive tract. People would say having something involving the muscles uh, is probably less threatening than something involving the kidneys, right? Just as a general sort of concept to try to illustrate what I'm saying. So similarly, having something on the skin is better most of the time than having something anywhere else internally inside the body. It's kind of moving out and away from the things that are most important. So just to kind of give you that perspective on healing and the healing direction. So if it's just run-of-the-mill minor kind of skin things, it's like coming up, I usually say, okay, that's all right. Don't worry about it. Everything else is getting better. Let's just stay the course. And I expect that in another few weeks, that will start to clear up as well. Okay, so if you already bought a pack or bundle and you weren't sure exactly how to take it, I hope that you have a really great idea of where to start now. You can you can look at the slides here and look at the one-page protocol and then the dosage guide that I gave you. But I would say also go into the description below and look at the technical papers for each of the products. There's a lot of good information there. It's not way too long or anything. It's a couple of pages. See what we have written about each product, and then the link to the protocol is in the description as well. And that protocol link is the full. So the first thing will be like the one page one that I showed you, but then there's a multiple page where it's broken down each phase. So phase one is broken down more specifically with dosages as well as the MEVI diet and some of the other things. So that's a great resource to have. And then you can also go into the comprehensive webinar that I did, and you can watch the whole thing. You can look through and see, go right to the specific product, or you could go right to the MEVI diet, just find what it is you want to go to in there. And but I work with a lot of folks who will yeah, they'll get products and then they're like, "Oh, I'm not actually quite sure what the best way is to use this." So I hope that if that's you in this situation that you're like empowered now, you're empowered to start on the journey. And here's just another kind of summary of what I already described. This is really just a summary of exactly what's on that one page protocol. The functional support is things I didn't talk about here, but that's in the protocol and on the comprehensive webinar as well. And download the protocol, the technical sheets. You can find a lot of other information in the resources section on the CanXida website. That link is in the description. Check out some of the other videos we've done. I mentioned the one on die-off. There's one on liver support that's gotten great feedback. So there's a lot of great information we're providing here.
check out some of the other videos and subscribe if you enjoy learning about this content and digestive health and Candida and improving your own health and that of others. Yeah, subscribe. And just in the bottom here, I just put my email, my clinic email. So you're welcome to email me at Dr. Blake at chironhealingarts.com if you have any questions or want to reach out to me for any reason. Okay, everybody. Thanks for hanging out and take care.